Hey, hello everybody. Welcome to Bill MacPhee's recovery blog. And as you know, our definition of recovery is when you wouldn't want to be anyone else other than who you are today. Again, today we're here at the American Psychiatric Association's annual meeting, the 168th annual meeting, and we are in Toronto, Canada, Toronto, Ontario, Canada, and we are here at the APA. And today I have a guest, Maria Roccisano, and Maria is from Mount Sinai Hospital in New York. And Maria has done a fascinating study on basically mental illness, schizophrenia, and marijuana. And as you know, I know that in the States there's some legal marijuana states, and here in Canada it's a big issue, political issue right now, and we're going to talk about legalizing marijuana, and we have medical marijuana treatment, different things like that. I think probably a lot of you know my views as far as I think that if marijuana gets legalized, I think in the mental health field we are going to have a spike of psychosis, but that's my take on it. But we're going to talk to somebody who's really done a lot of studying and a poster on this. So welcome, Maria, to Bill MacPhee's Recovery Blog.
Thank you.
And let's talk a little bit about your study and your work.
Sure. So we wanted to sort of explore why our patients, schizophrenic, bipolar, and depressed individuals, are using marijuana. And then once we looked at why they use it, we wanted to see if there's any connection with how severe their symptoms are when they present into the inpatient hospital.
Okay. So you had a series of questions. First of all, how many people were in the study?
So this is an ongoing study. Right now, the data that we analyzed, it was 53 subjects.
Okay. And was there a combination of male and female?
Yeah, male and female.
Male and female. And was it have 50-50 as far as the male and female, or do you recall?
I don't recall.
Okay. Okay.
Yeah.
So then basically then what you did, you had these 57 people, I think you said, fill out a questionnaire, correct?
Yeah.
And what were some of the questions on the questionnaire?
So some of the questions looked at why they used. So we asked them, did they use cannabis to treat their depressed mood? Or did they use it to calm their mood because they were too hyperactive? Or did they use it for fun? Or were they not quite sure why they used it?
Okay.
And then after we looked at that, then we asked them some things about their depression, and we rated that. And then we looked at some of their levels of activity, were they sleeping at night, those things, and how frequently they were using cannabis.
Okay. So in general, how frequently were they using cannabis then?
Well, we looked at an overall scale in terms of severity. I don't know the exact numbers, but what you can say is that those that are using it more have more severe symptoms. More severe symptoms.
Okay. Yeah, and so you have that. And what was the other question? Well, a major question on there for recreational. Some were doing it for recreational. Some was doing it for medical. Some was doing it for fun. And so what conclusions did you come out with? What are the conclusions?
So what we found is that people use it obviously for different reasons, and that people that suffer from schizophrenia and people that suffer from bipolar use it for somewhat similar reasons. And they all scored pretty high in terms of using it to treat their depressed mood and using it for fun. The people that suffered from just depression on their own didn't use it as much to treat their depressed mood. And then overall, when we looked at all of the subjects, those who used the cannabis to treat their depression were using cannabis more frequently, had more agitation when they presented in the hospital, and they had more severe depressive symptoms as well as manic symptoms.
Now, can you talk about, a lot of times we talk about self-medication or self-medicating, where somebody would basically start maybe when they're younger, have symptoms of signs of psychosis, they may be hearing voices or paranoid, not really an understanding about mental illness or knowing what's going on, but yet they would maybe turn to alcohol or marijuana to try to get rid of those voices or of what's happening in their life. Were some of these people who filled out the questionnaire, were they candidates who have self-medicated?
Well, that's sort of what we're speculating with this research, is that maybe these are patients that are self-medicating, and that's what these questions try to target. Like, are they using it to treat their mood? Are they using it to either bring it down or bring it up? So you can say that in a way, yes, they are self-medicating by virtue of the way they respond to the questions.
And the people who were taking the marijuana, how long have they been doing it? Like, have it at a younger age, or when they only experienced symptoms, or when they had the diagnosis? Was there a long term? What was the range of people? For how long have people been using marijuana?
So it really varies by patient. What we were interested in more specifically was that they had used marijuana, any amount, within the past 6 months. That's who we targeted. Whether they were using before that time, I can't say, but I know that everyone in our study had used at least once within the past 6 months.
Okay. So then, what is the next study going on now? What are we looking after now? Like, what did we glean from this, and to say, okay, the next steps we want to find out? Is there a continuation from this study that you want to do?
Yes, there's a lot of things that you can focus from this study. I think the important thing is that we know that our patients are using marijuana to self-medicate, and maybe this is an avenue to pursue as a provider, that you can sort of help them in their recovery if you're targeting more on these symptoms that they're using the cannabis to try and treat. And then I also think it's important to note that maybe this is a subgroup of individuals that are more sensitive to the negative effects of cannabis. And so I think those are all avenues to pursue.
Now, were the case studies, were they just people who used marijuana, or was it alcohol as well? Were any of them at the time of the study using alcohol as well?
Some of them were. We didn't discriminate. They just needed to have used marijuana. So some of them were using other substances. Okay,
very good. And so really, this is very interesting. Do you have any personal opinions? I mean, I shared my personal opinion, but that I believe there'll be a spike in psychosis. Do you have maybe personally, or maybe it can't be proven, but what are your, because you see people, right? You see people in your office, you're working with them all the time, and it's very common, right?
Yeah, well, I can personally, from what we see in the data, I would say definitely that patients that use marijuana get more agitated. Our psychiatric patients get more agitated. And whether that could be due to a various number of reasons, but I think it's important to focus on that, especially when you're educating your patients, that they might have a chance of becoming more agitated, and maybe you should avoid using.
Right, absolutely, yeah. Anyways. Well, listen, Maria, thank you very much for coming on to the blog today. Would you like to say anything else? Any closing remarks, or anything profound that you want to approach? No? Okay.
No.
Well, very good. Thank you for coming on our mental health blog. And remember, for all of you out there, is that there is life after mental illness. Have a great day. Bye-bye.